Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we've been talking an awful lot about the Affordable Care Act, particularly on the medical side, but what about the dental side? This is important. And then Governor Corbett is about to introduce his budget, and it's going to contain some pension items, $41 billion in pension. We're going to have the president of PSEA. They represent the teachers and other employees in school districts around the state on this program to get his reaction. We'll be back in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, this is an important discussion. I mean, we often kind of separate dental care from health care in other kinds of health care, and we don't talk about it in terms of its coverage and dental coverage, health insurance coverage. We don't talk about it in terms of the Affordable Care Act. Well, we got Dr. James Bramson. He's the Chief Dental Officer with United Concordia Dental, and Jon Seltenheim. He's a Senior VP at United Concordia. You guys are going to straighten this out for us, right?
Sure.
But you know what, Jon, let me start with you. We don't actually ever think about it that way. I mean, all the programming that I've done, I think you guys were on once before, and we talked a little bit about it.
Right.
What does the Affordable Care Act and dental care have in common?
So there are 10 essential health benefits, and the 10th item on the list is pediatric oral and vision services. So that means that there's going to be a mandate to offer pediatric dental in the exchanges when they go live in 2014.
So when you go and buy insurance, when you get on the health insurance exchange, in our case it would be the federal one, not the state one, right, doctor?
Right.
So what we're talking about is you'll get there and you'll buy, and only pediatrics, 3 of us are done, excluded from this?
On the exchange.
On the exchange? Go ahead.
In terms of a mandate.
The mandate.
Right. So dental companies like ourselves will be offering a pediatric benefit because that's what's mandated. But there will also be the ability through the exchanges to purchase an adult benefit as well. So it won't just be pediatric, but the mandated portion is for kids under 19. Okay,
so are you suggesting then, now there's this big debate of whether this is going to lower costs or raise costs. What's your sense about that?
Well, if you look at the services, they're pretty much prescribed by the default plan. So the pricing that normally anyone would have is pretty much the same around what that kind of a plan would be. If you layer some taxes on top of that, exchange fees and premium taxes, it'll probably go up.
Yeah. Now, I don't want to tell tales out of school here, but when I just talk to dentists, and I won't tell you where I meet them, not just on the golf, I was going to say on the golf course, but you get the point. And they tell me all the time that if you go and see somebody regularly, you don't have, and you do this for a living, you don't have the gum disease problem, you don't get, so what's your advice here?
Well, best dental insurance is probably a toothbrush and a new tube of toothpaste.
And a regular checkup?
And using it regularly and going into your dentist a couple times a year.
Yeah, so you don't get, all kinds of gum diseases that you can get if you don't.
And they're all preventable.
And they're all preventable.
Dental disease, whether it's gum disease or cavities, is preventable.
All right, let's talk about health care coverage for a minute, dental coverage.
Right.
People in Pennsylvania, we have a lot covered, not many people covered.
So there are about 12.7 million Pennsylvanians, and about 8.1 million have some type of dental coverage today. So about two-thirds have dental.
Okay.
And out of those, I think 1.5 million have it through public programs, and the rest through insurance companies.
So you have to buy it, and employers cover, there's a lot of employer dental coverage, right?
Sure. And so the Affordable Care Act portion of it is really going to affect small employers, those with less than 50 lives, as well as individuals who don't have coverage today.
Now we're back on this theme that you got to go regularly, got to get the regular checkups. We now have people, particularly young, kids are going to have coverage. You call it pediatrics, I call them kids. Kids are going to have dental coverage. But there are also some conditions that, particularly if you have diabetes, that if you're treated, how does that play into this?
Well, there's a lot of research out there that connects oral disease and chronic systemic or whole body disease, diabetes being the one where most of the research has been done. So it's thought to be that increased inflammation from the diabetes is harder to fight the infection around your gum tissue. So we actually went back and we did a study and looked at, since we're a subsidiary of Highmark, we looked at medical data and dental data for the same group of people, about 1.7 million people over 3 years, and we followed their dental treatments if they were diabetics, if they got treated for their periodontal disease and took care of it. We then looked at the medical costs, and over on the medical side we found that they would save about $1,814 per year on their hospital and doctor expenses by treating their dental disease, and another another $1,477 in pharmacy savings that we've just released in a recent study. So that's about $3,200 per year you could save on your medical costs.
We're going to run to a break. When we come back, I want to ask Jon about these. You brought up the insurance exchanges. We'll see where all that stands. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. We're doing an important, healthcare update, this time on dental care, something we've not done, with Dr. James Bramson and Jon Seltenheim. They're both with United Concordia. You estimate that we're going to push 800,000 people, young kids, right, that'll have coverage under this. Before I get to the other question I wanted to ask you.
Sure. That's our best estimate. That about 800,000 more children in Pennsylvania will have access. Now, we're still trying to work out with Washington, is it mandatory purchase? We know that we have to offer it. It's a question of, are they going to have to purchase dental? And out of that 800,000, probably half will go into Medicaid or CHIP.
Medicaid or CHIP. CHIP, of course, being the Children's Health Care Program begun under Governor Casey. All right, the exchanges themselves. Mm-hmm. Governor Corbett has said, no, we're not going to do it in the state. We're going to let the federal government do it.
That's correct.
Talk about what's the insurance exchange, and why should the folks out there care about that?
So they're going to be, in essence, two exchanges, one for individuals and one for small groups. And they'll be effective as of October 1, and individuals will be able to go online and purchase medical and dental coverage through the exchanges. Mm-hmm. And the same thing, small groups can do that as well.
So in other words, people that don't have, let's take this population, people that don't have coverage now, be eligible for coverage. Right. We're talking about 15 million people across the country. I've seen estimates about 700, 800, and maybe a lot more if we include pediatric care, dental care. So you don't have coverage now. You're going to get on one of those exchanges. Is that right? Correct. And then what are you looking for?
Well, you're typically looking for what benefits there are, what kind of coverage do you have, and what's included or what's not included, and what's the price.
What's sort of fascinating to me, and we've done some programming on this before, is this is very complicated stuff.
It will be. What
I don't know is how a consumer, take me, if I were to get on there, I wouldn't have a clue. We're going to have navigators, that's what they're called, or advisors, people who say, here, I'm going to give you help. And maybe we're going to see people going to do this for money, American, how we are.
And there will be groups who are authorized to be navigators. Yeah. So traditionally it's been through brokers and consultants and so forth, but due to the Affordable Care Act, there will also be navigators, groups that are authorized and reimbursed to help.
I was going to say they're going to get paid for this, right?
Exactly, yeah.
Hey, before I let you go, I wanted to ask you, again, back to the diseases, the gum diseases. that, you can argue, as you did quite well, about the savings in money plus in the healthcare implications. What other diseases do you all look for?
Well, we've now begun to take that same data set, and it's actually bigger now, and we're looking at cardiovascular disease, cerebrovascular disease, rheumatoid arthritis. We're also looking at pregnant women and taking a look at the cost of their pregnancy depending upon whether or not they have periodontal disease and whether it's treated. So there are quite a number of other things we're taking a look at, mostly all chronic diseases where there's inflammation at the root of it.
Right. All right, well, look, this has been a wonderful update. I don't know, I know we started this one time, we've now gotten a lot into it. So the final word here is, what's your advice to the consumer, to our viewers out there in this year? If you start from, what would you tell them to do?
I would say
they're looking for health care coverage.
Sure, absolutely. Just listen there'll be plenty on radio and TV. There'll be plenty in the newspapers and online. So as we get closer and closer to October, there's going to be a lot of media campaigns to encourage people to go online, check it out, to go on to the exchanges and see what's offered. But there'll also be toll-free assistance, both through the exchange as well as companies like ourselves.
Great advice, and we got your advice, which is wonderful. Like, go to the physician, go to a dentist, see them regularly, right? Get all that going on. All right, pensions, a huge issue coming up in Governor Corbett's message a couple of days from now. We'll hear more from the president of PSEA on that subject after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, in a couple of days, Governor Corbett will deliver his budget message. One of the topics, a huge topic, will be pensions. There's a $41 billion deficit to the two pension systems. Joining me is Mike Crossey. He's the president of PSEA, a teacher for more than 30 years. We're both teachers here, and we're both in one of those systems, so full disclosure. You were watching this, you came on here, you were watching as a teacher the last segments about this dental care, and you made a great observation. What is it?
Dental problems for our students in schools is either the number one or the second leading cause of school absences. It is a real problem in school, and I completely support the recommendations that were made by the previous two guests you had, that we need to make sure we have comprehensive dental care in our schools and available to our students. It is critically important to, one, the health of our students.
Get those checkups, right? Get those teeth worked on.
Get those checkups. We can't afford to keep missing students from school.
Yeah, you know what? I'll tell you what, every show, something happened. I learned something. I didn't, it's something you don't even think about. Well, look, as you know, there's been a lot of debate over this business of the pensions. $41 billion. We have these two large pension systems. As I pointed out, you and I, you're in one, I'm in the other. Retired, left Millersville, now at a private college. You're of course a teacher more than 30 years out in Allegheny County. One of the problems that it seems to me that the pension system has is that for a number of years, they're funded by an employer and an employee contribution, right? A number of years the employer didn't put any money in.
That is the second biggest cause of this crisis we're in right now. The governor has a budget crisis, and we'll talk about that. But the pension portion of the crisis is one caused by the fact that we had two huge recessions in the last decade. But the biggest other problem besides the recessions that we've had is the fact that starting in the year 2000, the governor and the politicians in the legislature at that time decided to take a holiday. They decided to not pay into the system. And in that whole decade there, from 2001 up until 2011, the employer side of the coin put in less than half of what the employees put in.
Yeah.
Prior to 2000, the pension fund was funded at 123%. Pension fund was doing great. The employees were all contributing. The employers were contributing. At one point, a decade or so ago, the employer side, the school districts and the state combined, were putting in up to 20% into the pension fund. Pension fund was doing great. It was making good investment returns, smart investments in the future. And starting with Governor Ridge in the year 2000, they put in 0. And then after that, they've averaged about 4.38%.
Right?
Absolutely.
Could be bipartisan.
Bipartisan,
yeah.
absolutely.
No, I understand.
There was that whole decade there.
And then they did in 2001. They expanded they increased what they call the multiplier, adding 25% in benefits to employees. Lawmakers took care of themselves, 50%. And then in order to get vesting, that means the state, that you would get the employer contribution as well as your own back when you leave service. They reduced the amount of time from 10 to 5 years. Did that have an effect on the investment portfolio? Did that, or the fund? Go ahead.
It did. The Act 9 of 2001, which increased the multiplier, every single employee in the system had to actually sign a sheet of paper, because our pensions are a contract with the state. So every single employee in the system had to actually sign a piece of paper saying, I accept this multiplier increase, but in return for that multiplier increase, I agree to raise my contribution. So we raised our contributions on average, because it depends on when you started in the system, but on average, every single employee increased their contribution from 6.25 to 7.5% of every paycheck. Now,
at the same time, the employer was making no contribution in that period.
Exactly. Now, but at the same time, did it have an effect on the pension problem we have today?
Right.
Yes, it did. 19% of the problem we have today is because that 2.5 multiplier increase was retroactively applied. So a portion of it is because of that, but it's not the major portion. The major portion, 81%, of all of the problem we have today is a combination of the underfunding by the employer side of the coin and the two big recessions we've had.
All right, we're going to take a break. When I come back, I'm going to ask Mike what he thinks, what PSEA thinks ought to be done moving forward, an important topic. Then if we have some time, I want to talk about funding of education. It's a huge portion of the budget. There have been cuts proposed but not realized, although Mike may take issue with me. They restored the budget last year. How much of it Mike will tell me about after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. We're talking about this huge issue of pension reform. The governor in a couple of days will make his recommendations about it to the General Assembly. We're sort of getting an advance out with the president of PSEA, Michael Crossey. All right, PSEA, moving forward, how would you resolve the problem?
I think what we need to do is let Act 120, called the Pension Reform Act of 2010, I think we need to let that do its job. We came together with the governor.
Now, hold on. That means we go back to 10 years for vesting. We reduce the multiplier from 2.5 to 2. So everybody's going to get about 25% less in benefits, just generally. Is that right?
All new employees.
All new employees.
All new employees.
That's right.
Act 120 took all those things back. You're right. It increased the vesting period back. It lowered the benefits to 2.0. It eliminated option 4, which is the ability of employees to take your money back out of the system when you retire. That system lowered the cost for new employees down to 2.2%. So there is no system out there that they could create that has a lower cost per employee than 2.2%. Even if they, and I understand there's going to be some bills floated out there to switch new employees to a 401k type, they don't work. Even back in 2010, when we were researching and doing the work for the new law, PERC, the Pennsylvania Employee Retirement Commission, analyzed all the other options out there in the field and said none of them produce better tax savings for the taxpayers than Act 120. So Act 120, I believe, is the solution to the problem. We lowered the cost for benefits for all new employees. The blended rate for employees is about 8% right now. And as employees retire and new employees come in under the new rules, that cost should go down every single year. Now, the cost is there, and there's still a heavy lift to pay.
Sure.
But the lift is not for pension benefits being earned by employees, which is where the governor seems to want to go. He wants to cut employee retirement benefits. It doesn't make any sense because...
even he has admitted, I think, that he can't do much for current employees.
Right.
I mean, I think, they know about retirees, so... Well, I want to get on to another subject,
Sure.
but look, we're going to, after the governor has his plan, we'll get the others, we'll get some other points of view on this. All right, the budget, what are you looking for? State budget, ed funding,
I think the governor 2 years ago shortchanged our students and our public education system, including higher education, by $1 billion. I'd like to see him restore some of that funding. School districts across the state have increased class sizes, delayed buying resources, stopped fixing buildings, laid off 20,000 educators, eliminated 20,000 jobs in his state. I think the governor's program 2 years ago was absolutely atrocious for public education.
Now, he's pretty much indicated that there's not going to be any cuts, that you're probably going to start in the debate with the flat funding, meaning no new money, but maybe the same money. So you are looking at a different situation than last year when he recommended $1 billion in cuts to the school districts, right? Right.
The governor last year again recommended another $100 million cut in education programming fees. But at this point, it looks like, he's going to provide the legislature and he's going to provide the taxpayers of Pennsylvania a lot of false choices this year. This year what he's going to say is, okay, we're flat funding, so you've got to make choices. We've got to cut somewhere. Where do you want to cut? What the governor's got to do is the governor's got to step up to the plate, not worry so much about the pledge he made to somebody down in Washington, D.C. And the governor's got to... Grover Norquist. The governor has got to fund the system.
All right, thanks. We're always glad to get your point of view. Thanks for coming on the program. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.